part.
I've been to the drainage case.
Well, it looks like I've already entered everybody. That's okay. See what it does here.
I don't know if it's gonna be an 8 or 10 cough drop night. We got a whole bunch.
You got a cough?
All right, here we go. Elan.
I know.
Got a cough, got a tip.
Let's go through all the questions.
Okay, once you
Okay.
finish reading.
Anytime you want to start. Got it. Thank you very much. Start standing up.
Did the audio work on it? So,
Get your gavel?
and we're live, okay, we're live.
We're okay?
Yeah.
Thank you. I just needed to get on there. No, do we need to wait a second? No, I got on. Thanks. Okay. All right, I'm going to call us to order. Please rise and join us for the Pledge of Allegiance. The flag is located at the
Flag
back.
right behind you, please.
I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
So we need a motion to accept the, a motion to adopt the agenda as presented. Do I have an agenda? If you don't, I've got Linda's, and I will be serving as secretary
I
tonight.
can see that mine.
Okay. Oh, you're
Going to
okay.
act as the secretary.
Erin just said she's going to, I guess, right? Is that what you said?
Yeah, because I'll be here through
Okay,
close
thank
to
you.
two. Yep.
Any changes in this?
Let me take a look.
Said as presented.
Thank you.
Move we adopt the agenda.
Hold on.
You got change?
Frazano, where are you at? We need to get your name spelled correctly. Can you spell it for us?
Yes, C-H-R-I-S-T-I-N-A.
T-I-N-A.
S-T-I-A.
And then, how's that last name go?
And the last name is Bersano. It's B as in boy, E-R-S-A-N-O.
Okay.
Well, we're getting close.
There was only a letter off on each one.
And that's Carrie Pointer's with a C? Yeah? All right, okay. Any other changes as presented? I don't see any.
Dr. Meyer,
Yeah.
I have a text saying that they can hear, but they can't see.
Oh. Well,
Was there what?
Is there a cap or anything?
No, it's not a cap that I could see.
No.
and do we have a microphone for the public comments?
There's one.
It is, it's up there?
Podium up there.
Hiding again? Okay.
You were in tune up.
Oh, I thought you said Aaron, not Aaron.
Oh, sorry.
No, you're good. I was like, I'm ready.
Okay, I don't know, was it just a text from the
Okay.
saying they can hear, but they can't see?
I know, it's nothing.
Okay,
Okay, good deal.
okay.
Okey-dokey.
I will let her know that. Thank you.
Anyone want to move to adopt the agenda as
So
presented?
move.
Second.
Who wants to call that one? I think I heard Varner first. All right, all those in favor?
Aye.
Any opposed? All right, we need to welcome up for public comments. And just to clarify, I mean, the policy has some language in it about 5 days prior to the meeting, but this meeting wasn't called with 5 days for you guys to really adequately prepare. So, like, get your request in. So I was happy to make an exception. The first up for 5 minutes, we've got Deanna Donnell, Carrie Pointer, Christina Brazano, Teresa Hoy, and Curtis Gregory. So we will recognize those individuals. Your microphone is over there. I've got it on the thing. You've got 5 minutes, and you can let me know when you want me to start the timer at the end of the 5 minutes. We'll have to excuse you so that we can, yeah. Oh, okay, that's fine. Let me know when you're ready. Can we get a
We won't
comment?
necessarily know that, Deanna, we won't know that we can hear you. We
Right.
won't be able to hear you through that mic. It just goes to the camera, just FYI.
Good evening. For those of you who don't know me, I'm Hannah Donald. I have 2 children currently enrolled in Marshall High School. I first want to thank the board, especially Aaron, for allowing us parents to have a voice tonight. I know it was last minute, and I know that you didn't have to grant us this, and I do appreciate it. I'm going to be short. Again, I wanted everyone else to be able to get up to speak, and I didn't want your meeting to last a very long time. But I did want to say a few things. I did give you guys a handout that I hope everybody could review. I will refer to that. First off, I feel in the community we can all agree that we want our children properly educated. We understand that you guys as a district, that we have barriers that we're struggling with. We as parents and a community want to help remove these barriers in order to best educate our children. I know that the knowledge about the virus itself has been one of the major barriers for everyone. I'm in the medical community. It is a huge barrier. We know that it's an ever-evolving thing. If anybody didn't know anything about science before because they didn't like science, they certainly know enough about science now. That is ever-evolving, it's ever-changing, and sometimes we just have to be patient and wait for data. Okay, is that better? Okay. So I know that the knowledge about the virus itself has been a major barrier for everyone. However, a lot of data now exists concerning the transmission in schools and how it affects community spread. I will refer to you to the handout that I gave you all and you received. The CDC director, Dr. Robert Redfield, again, the CDC director, Dr. Robert Redfield, states that schools are among, quote, the safest places kids can be. Closing schools is, quote, an emotional response, not backed by data. UNICEF warns of a lost generation and finds school closures are ineffective. A new report by UNICEF warned that the future of an entire generation is at risk, with the threat to children increasing and not decreasing. The report found that school closures did little to slow the spread of the virus while causing long-term harm. Data from 191 countries, that's countries, show no consistent association between school reopening status and COVID-19 infection rates. End quote from the UNICEF report. The UNICEF report found that school closings has not been proven effective in slowing the spread of the virus. Last Sunday, Dr. Anthony Fauci, who we all know very well, stated that all schools should remain open because, quote, we know the spread from children is low. I could go on, and I don't have time to tell you more data from him and other sources. Locally, Governor Parsons in DESE and the DHSS, working with Dr. Rachel Orschlin, Associate Professor of Pediatrics in the Division of Infectious Diseases at Washington University and St. Louis Children's Hospital, revealed updated quarantine recommendations for K-12 schools that have been very helpful for many other school districts that are still in-seat, in-session learning with very similar issues. We all have the same issues. We are here to say as parents that our current plan is not effectively educating our children in our community. This plan is not sustainable for another 6 months.
1 minute.
The plan is failing. It is not the teacher's fault. I repeat, it is not the teacher's fault. Our kids need to be in school with their teachers every day. It's a terrible situation. We want to help find solutions. We need a new plan. Thank you.
Thank you. And I should clarify, I was under the impression that you would be speaking as a group, so the 5 minutes really was for the group of you. So do please be very quick with your comments, because we do have the attorney waiting for us on the other side of the open session, okay?
I'm sorry, just
try to keep the mic as close as you can.
Pull your mask down so they can hear you.
And I thought I only had 1 minute as well, so I was kind of worried that I would not have enough to say. I'm Carrie Pointer. I work in the child welfare community and have for 22 years. I'm not only here as a parent, and I have 2 children in the district, and I just want to say I appreciate the teachers and the social work staff here at MPS. But I'm here as a child welfare advocate because I'm concerned about my vulnerable kids. I am worried about the kids in this community. They're not getting seen at school. Our reports of child abuse and neglect dropped 50% in March. They were low throughout. They've come up a little bit. But there are kids not being seen by teachers who are mandated reporters. I was disturbed yesterday when I read somebody say, it's just 2.5 weeks. 2.5 weeks to me, 2.5 weeks to a child that's in an abusive home is 2.5 weeks they could tell a mandated reporter what's going on with them. That scared me and it bothered me and I didn't sleep last night. I'm going to leave it at that. I appreciate your time. I appreciate this community. I appreciate the board and MPS. But think about our vulnerable kids. Thank you.
1 minute on the dot. Impressive. All right.
Hi, my name is Christina Bersano. I have 2 kids in this school district. First of all, I do want to thank you guys for your time. I do want to offer condolences to our community, to all who have lost loved ones, and to those who are ill as well. I'm just coming as a concerned parent. I also want to mention that I am a healthcare professional. I'm a parent, as well as I've subbed in the school district, and I've been the focus room teacher. So I've been and I've seen all sides. And this is a very serious thing. The virus is, we don't want to downplay that. We don't want to downplay our teachers as well. And we don't want division, and we don't want to point blame. That is certainly not the case here. As a concerned parent, my daughter, who's a 13-year-old girl, I mean, all kids right now, they want to be in school. We know that. Some kids just do not do well online learning. Even though the parents are giving our best effort, we give all we can to our kids to try to help them. And my main concern for our kids is their mental health. I've been seeing some concerns in my own children with their mental health, and it is concerning, and I have to assume that, and I don't like to assume, but I have to assume that there are other children in the district who are having concerns with that as well. And again, tonight I come asking for unity. And so my ask of the board is to just think of ways, options, and we are not demanding anything. I want that to be clear. There's no demanding here. They're just asking for consideration for options on the way we can think outside the box and we can get our kids in school safely, but we can also put safety as a priority. And we can also look at the mental health aspect as well as getting a quality education.
Thank you.
I'm Teresa Hoy. It feels weird to introduce myself to people I've known all my life. Thank you for the chance to come and speak. Today, I'm just talking to you as a parent regarding how first semester has looked in my home and how we feel as a family moving forward. I have 2 students in the district also, a freshman and a 5th grader. They were both in-seat learners prior to going full distance. Using today as an example, average instructional time in my home is 2.5 hours a day for my freshman and 1.5 hours for my middle schooler. That's time with their teachers in front of them. To be clear, I'm not knocking all of those teachers at all. I believe we've asked the impossible of our educators this year. We've asked them to teach in a manner few of them are trained for, and using materials and techniques designed for classroom and not remote use. I know that, I'm aware. However, as a parent and advocating for my child, that freshman will be a junior in 2 years. He will be taking the ACT and competing for college scholarships along with his peers from Smith Cotton and Santa Fe. Those peers each had 16 full instructional days in the month of November alone. My freshman has had 18 since March 13th. Assuming we don't return to full instructional days until mid-January, he will have had 18 full school days in 10 months. That's not very competitive edge for a bright young man. I'm asking you, as senior admin on the board, to look to some of those nearby districts, larger and smaller, to find a better solution than what we're currently utilizing. What are they doing well, and how could that work here? I realize there are no perfect solutions to this year at all, but I believe wholeheartedly that there have to be better ones. Thank you.
Thank you.
I want to get that number. Did you get that? That's. I got it right?
My name is Curtis Gregory. I have a stepdaughter that is a senior in high school. I'm just kind of up here to speak on how I see things. for the last 9 months, it's been Corona's world and we're just living in it. I applaud the board, I applaud the teachers, administration for trying to work through it the best you can. I feel though, as we've read in some of these studies though, that we are losing a generation. And I have heard people say, you can't make this education up. When? Because in Senator O'Loughlin's letter, I had her write up because she is the chair of the Education Committee in the Senate. Columbia Public Schools are dropping their standard to move kids on to the next grade. So what you should learn in 5th grade, now when you're going into 6th grade, you should be learning 6th grade level things. They're not going to have the foundation from what they should have in prior years. How is that going to affect them going on forward into high school, and as Mrs. Hoy said, going on into college? I look at the school as being a backbone of a community. With strong school systems, you're going to attract residents, you're going to attract businesses. This school has to be as successful as possible as it can. I've heard the rumor, myth, whatever it may be, that some businesses have looked at this community for economic development and they will not come here because of the school system. I'm not saying that's the truth, I'm saying that's what I've heard. I want this school to be extremely successful. I want the town to be successful, the county, my entire district, the 51st district in the House, representatives from Missouri. I applaud you all for everything you've done in working through this. We have to find a better solution because, as she said, 18 days of school, face-to-face learning, I don't know how that's going to cut it. We had a kindergartner last year that had a very good preschool education, and once she got into kindergarten, was moving along, and then we were shut off in March. And it took until about the last couple months for her to, I feel, to get to where she needed to be at this point. So all I'm saying from this standpoint is we need to know a little more of a solution of when we're going to be back in school. We need to know a plan. And I think we need as much face-to-face learning as we can have. The governor and DESE have done the best they can to put tools in the toolbox for schools to be successful in limiting close contacts for quarantine periods. I see that as being out the window now if that policy is adopted. So that being said, I thank you all for your hard work. The teachers out there, I can't applaud you all enough for dealing with a situation that you did not go to school for. You did not go to school to learn how to teach across Zoom and Google Classroom. You went to school to learn how to teach in a classroom and on a whiteboard and using PowerPoints, et cetera, et cetera. So thank you for your all's time. I appreciate everything you all do again. Thank you.
Okay. All right, thanks to all of you folks for coming on in, and since we're in phase 4 and the school buildings are closed, we will ask the people who are no longer part of that public comment if they will kindly step out. So,
Is that a rule?
Thank you.
Is that a rule?
is that what we did last time?
What we did last time when?
At this time.
Huh?
All meetings are closed at this time.
Our agenda does not say that. November 23rd's agenda did say that. This agenda does not say that.
It was left off in error then.
They're supposed to be closed, but it
It's not a closed session, though. We are in an open session.
That's correct. So it was offered online, but however, it sounds like some information went out incorrectly.
Make sure that,
Yeah, so,
yes, it actually said on the last agenda that this meeting, all meetings will be closed at this time.
But that's not what it says on this agenda, just making that clear.
Okay. Thank you.
All right, CTA. I'll let you know when you got that 1 minute left. Whenever you're ready.
Okay. I want to start by thanking the board for the chance to speak tonight. Again, I stand before you as the elected representative of the Community Teacher Association. It's important to note that our ranks do not just include certified teachers. We also count custodians, bus drivers, food service workers, classified staff, administrators, and nurses among our members. Beside me, or here with me, is Sam Sampson. She is the representative for NEA, which is our sister teacher organization, and this is Lori Wendell, who is a member of CTA. As I stated previously, I represent the employees at MTS. With that in mind, I want you to know that all of the thoughts, feelings, and words that I'm going to share with you tonight are from the almost 90 emails that I've received since 2:30 this afternoon. And because I know you're going to ask, all but 4 reflect the information I'm going to share with you. The people I serve spoke much more eloquently than I ever could hope to, so I thought it would be best just to simply share their words with you. I think we established a plan, the Return to Learning Plan, with student safety and best interests in mind. This plan needs to be followed as written. Nothing has changed to make it more safe for kids to return now than before. I think our students need our help understanding disappointments and learning how to handle them. The attacks I feel coming at the school district from the community are not doing that. It is establishing the children as victims, which they are not. I 100% disagree with returning to school now. There is a plan in place and we should follow that plan. The board approved of that plan and the board is involved in the current Return to Learn committee. If they overturn all of those decisions, I believe it would lead to an even more distrust of the board. It would show me that they will not even follow their own suggestions and policies. I urge you all to make the decision about what phase we are in based on the parameters set forth in the Return to Learn plan. Don't stray from it. The trust the community has in the school district will continue to fade if we say one thing yet do another, or amend our words after the fact to fit our current desires. If there is any hope in establishing a future where the public supports the school in any way, we have to provide a predictable and consistent message and be true to our word. As someone who is new to the district, it is hard to stand proud as an owl after reading everything being said and posted on social media about the district and teachers. We have been torn down so low for doing our very best for our students. And believe me when I say, some of us already feel like we are failing every day with what is being asked of us. We want the kids back as much as anyone else, but we also want everyone to be safe and healthy. I think we need to take a step back and make sure we are doing what is right, not what is easy. Not only are our cases still in a dangerously high range, we have nearly doubled the amount of deaths within our community over the past 2 weeks. The fact that almost all of these deaths were at a long-term care facility stems back to my point about spreading the virus in the community. The people living in these facilities are not the ones going out and contracting the virus. It is being brought into those homes through community spread, which having been seen instructionally amplified. While we do have measures in place to help lower the risk of the spread, these are not guaranteed prevention measures, just factors to mitigate the chances of spread. When the numbers reflect a safe shift to a lower phase, I'm all for it. But we are not in phase 2, 1, 2, or even 3. To act like we are is inviting disaster. The Returning to Learn plan was written with a great deal of thought from the district and the healthcare professionals. To ignore that is completely ridiculous. If the community wants to get serious about getting kids back to school 5 days a week, they should start by following the 3 primary guidelines of the CDC and making sure their kids do the same. Until the community takes us seriously, the situation is going to become worse, not better. I also got an email from a student. I'm going to share that with you now. I know I'm not a teacher, but I really want to share my thoughts on this. Yes, it would be great if we could go back to school in person, but I just don't feel safe at school. There is so much spread of COVID-19 right now, and it's just crazy that anyone would feel safe going to in-person school right now.
1 minute.
I miss normal school so much, but I don't want to risk others' lives by going to school when it is not safe.
1 minute. Just want to make sure.
Okay, finally, I think that these thoughts kind of summed up some of the overall theme that I heard as well. We as a community have an opportunity to shape our young people's experience in the pandemic. We can talk about how unfair it is, how badly we're being inconvenienced, or point fingers at people making decisions we do not agree with. Or we can talk about the effort we're putting into keeping the vulnerable members of our community safe, how the school and the community came together to provide the best possible education for our students while keeping safety as a top priority. We can have the opportunity to say to the community that our steps to keep students safe contributed to the decrease in the number of cases and deaths in our community. Thank you.
Thank you. Okay. And we wish you guys a good evening as well.
Thank you.
Thanks.
Thank you, Mindy.
You can just lay it there, I'll get it.
When you switch it off, it's probably off. I don't know. All right.
So I'm just gonna let Brian do all the talking.
Okay,
but
folks,
thank
we're
you.
just, folks at home streaming, we're
I
just
guess I can get in touch with
rearranging,
you
letting
if I
people
need
get
to.
out the door. Okey dokey. Do we need Ms. Gillespie for talking about R2L? No? Okay, that's fine. I didn't know if she was staying. Clearly she's not.
Do we need Diane to talk about R2L?
Oh, Diane, she can stay.
Legit question. I didn't know if she was.
No.
No, we don't.
No, we
Okay,
don't
never
do
mind. Good night. Good night. Okay, time to move on to talking about the Returning to Learning plan. The only way I want to frame this up is to say that I started myself a little project a couple days ago. I thought to myself, boy, I don't get on Facebook much nowadays, but it is vitriolic. And it's probably best summarized by a guy I graduated from high school with, lives here in town, sent this email. I got it, Dr. Mayer got it. Good evening, you guys. Hope you're doing well. I read a whole lot of stupidity on Facebook today, which I just thought was funny. So I wanted to take a minute and write you and tell you that my family are fine with whatever decision you guys make. We elected you all to make the best decision that you feel is best for the majority of us. There's no pleasing everyone. It's impossible. So just do what you feel is best. We'll make it work. Thank you for all you do. It's a thankless job with a town full of other people telling you what to do. And just know that most of us may be silent to avoid all the social media drama, but we're behind you. Anybody out there who's feeling that way, thanks. For everybody who is we're in a community, aren't we? Aren't we trying to work together? If we're trying to work together, if we're a community, why are we treating each other like enemies? Why are we talking about each other in terms of war metaphors? Why are we doing that? I don't know. The last thing I'm going to say, I spent a lot of time listening to Adam Hamilton preach because I couldn't go to church, during the pandemic. And he just preached a sermon series on unusual generosity. And I've been thinking about that a lot lately in terms of how you're generous to your other person. We all live in this community together. And if that can't be a guiding light, I don't know what hope we've got for really making things work together. But there's something to be said for charitable listening as well. I didn't come in here with an agenda tonight. I came in here to find out some information about how the R2L is being changed. I'm not here to push any ideology. I'm here to listen. So I'm going to turn it over to you, Mr. Jakes, if you would like to run us through what happened with R2L's working group.
So yesterday we had a meeting. For those of you on the group, thank you for your patience, like I told you yesterday. We were on the meeting yesterday from 3:30 until after 6 o'clock. So I don't want you to think that anything was taken lightly with the group or in the conversation or the topics. We went through the entire document. We talked about a myriad of things, and like probably most of the rest of the board, we probably have had another 30 to 40 emails or even more today trying to encourage us one way or another. So, how
Hey,
about
Brian,
the plan?
hold on just a second. Aaron, what you just said a minute ago, is that a public comment? Is that considered a public comment, like, as far as legalities of the board? And you reading that letter, I think that would be a public comment, right?
No, it was just my, random saying, hey, this is
Okay.
something somebody said to me.
I just think we need to be really cautious in that. I just got a message asking, is this on the agenda or is this public comment? So I'm just,
No. This is just like a note it's the equivalent of a note somebody handed to me as I walked in the door to say like, hey, hope you feel better. And I'm just like,
Okay.
hey, you guys, we got some support.
Both supporting material.
I appreciate hearing some support.
I think I don't think that group that just left is not in support either. I think they just want answer. They want some information.
The tone of what I hear on Facebook is concerning, but that is what it is. So,
Sorry, Brian, I just was asking
You're
just to
fine.
clarify.
And-
I guess the president needs to
just
recognize
from-
whoever's texting.
And just to reiterate or reflect what Aaron is saying, we have all heard it on both sides, in the community.
All day.
And, and none of these decisions have been made lightly from the beginning in August when we started this plan to tonight, to next year, and as we keep going forward. There's a lot of thought, there's a lot of time, there's a lot of energy that goes into all of this work. So, our return to learning plan hadn't been overhauled, for lack of a better term, or effectively updated a lot with the new guidance that we've received in the last couple of months. The guidance from November from the CDC, from DESE, from the governor. It hadn't been updated with some of the figures of facts since September in certain areas. So Dr. Mayer and I got together before the committee meeting for another couple hours, pretty much through the course of this week, and we brought it up to some current language. As you can see now, it starts off talking about the state of where we are kind of in December with these schools. I know the board has had this to review. The public will be able to get this to review. I'm not going to give you a timeline. The group is still working on making sure that this draft comes out as a complete document as it was in the first place. So don't say that tomorrow afternoon you're going to get this. That's not necessarily true.
Yes, you
There's some
get that.
parts that still need to be revised and tweaked within this. So we looked at the new CDC. We as well looked at, from Dr. Redfield, information as well and have included it in here. We've looked at the guidance from Governor Parson, who said that NC learning should be going on and be continuing, as well as DESE and DHSS. So all of that information is now included in, as well as close contacts, updating of quarantine periods or things like that, as CDC guidance has changed even this week and will be changing probably in the next 48 hours as well, and has changed in the last 48 hours as well. So that has all been updated and changed. We have currently removed the table that we were actually following, the NCMC table. Dr. Mayer and I talked about it, and we actually are the only school in the conference that was still following the table. Everyone else has disbanded the table. We also talked about some accuracies or maybe some inaccuracies that we may not have noticed. One of the things that I brought up to the committee yesterday and was kind of, everyone kind of took note of that, is that we don't actually count the mitigation strategies against the community spread numbers. We've been counting the community spread numbers on the top line. We don't necessarily give ourselves credit for the mitigation strategies. I was not able to find anything that showed where we should count points, and Dr. Mayer and I kind of threw some numbers back and forth, and we've asked Jim Paprick and Travis Reed to look at those numbers and to come up maybe with a formula that more suits our district. We aren't going to be using a district or a formula that's going to be derived from anywhere else. It's going to be something that's shaped more for our community. The past one didn't give us, what I was saying for mitigation, if we're saying we get maybe a point or two for each of the 5 strategies we're using, when we were coming up with numbers that were 30, or now we're down to, I believe, somewhere around 19, 17. You know, so are those numbers where we would maybe decrease 10 from that, or maybe decrease 5 from that? That would move us back into places that are actually within our orange or yellow categories. That would make it more livable for us to be able to return to school and to be able to evaluate some instruction time. So there were a few things that were just slightly off. Temperature recordings that some of the nurses that had showed us from going from 100.4 to 100. 100 degrees has been the standard that's been used in schools as far as sending kids home for years. 100.4 was the CDC guidance, as most of you are aware of taking the temperature and sending one home from a workplace. So we moved it back to what we've always used for a standard of 100 degrees. There is some updated information about what's going to go on with, as far as employees, how that actually quarantines will affect you, how actually those periods will be and things like that. We've added in the state of Missouri guidance because that is the guidance for the state that we're in. The departments that we're held accountable to as far as funding and the expectations that they have across.
Meaning, what page are you looking at? I'm trying to keep up with you. I'm having a hard time.
I'm sorry, I'm just kind of flipping through. I'm on page 7.
I'd like to take you back to 4, the very last sentence, and efforts of maintaining social distance is expected in all classrooms. We don't have that ability in all classrooms. I think we need to reword that to the best of our abilities that we are going to do social distancing, because that says that we are doing that and we can't.
Yeah,
It's not that we're not doing our best, it's,
Some of our buildings are just too small. We've got too many
Right.
kids in the classroom.
I just think we need to make that wording that we're just not able to,
I'm
that
not
we'll do it
Google
to the
Girl.
best of our abilities.
Absolutes are kind of
Yes, get rid of the
dangerous.
absolute when it's not there.
Yeah.
Are you talking about, Christie, where it says efforts to
She's talking about the
Yes.
bottom of page
Page
4,
4.
the last bullet point.
Okay. Well, it says efforts, so, I mean, but, efforts to maintain social distancing, I think we're making efforts. Not in all classrooms are we successful.
Right.
So
And
should I just add that?
I'm fine with that change. We can take that to the group as well and just put that back in. It's basically the same thing. It's 6 of one, half a dozen of another.
Yeah,
We're making efforts and we're doing it to the best of our abilities. So haggling over words is.
No, and that's, and Dr. Mayor, honestly, rereading that after you said it, I mean, I'm perfectly fine with that. I got this really late and after work, I had 1 hour to go through this whole thing. And so when things caught my eye, I took notes. So,
I get it.
Yeah.
definitely.
I'm gonna cheat off her paper, so when the notes come, I'm prepared for the questions, so.
Yeah, right big, Christie.
So, going back to page 7 where I was saying, we noted that the new guidance that is from CDC, the new guidance that is from the state of Missouri, as I said, the new guidance that's from DESE is down on the bottom of that page as well.
And what's the date on them that you used?
Excuse me?
What date on that CDC guidance in the state of Missouri?
This is
When-
the newest guidance that is available. This is guidance from this week.
As of Wednesday.
As of
Yes.
this past Wednesday?
Yes.
I think all of this is
Okay.
within 2 weeks. isn't
Yeah,
it?
all of this
Yeah.
information
It's
It
really
is,
within 5
changes
days.
every day, so.
Yes.
yeah.
You know, everybody's, well, that's old data. I mean,
No,
tomorrow
this-
that could be old data. You
Right?
don't know.
Tomorrow it could be.
It very well could be. But most of our stuff was still from September. You know, that was still in there as
Right,
far
we
as the
needed to
guidance and
update.
those things. We hadn't updated in November with any of the new guidances that were out from about mid-November on.
Wow,
So,
yeah.
we talk about the mask, the face coverings, those types of things, about the mitigation strategies that we're using within the district, and there's some things that are going to be removed because they are just timed and dated, that are in there. So you all have this document in front of you to kind of look over. Most of the major changes in the phases, there is a couple of changes in phase 3, and there are some substantial changes in phase 4, if you all notice. A lot of the criteria, or not criteria, but a lot of the things in phase 4 have just been removed. One of the larger changes as well within phase 4 is that moving to a regular 5-day work week for our teachers on site versus 20 hours in classroom and 20 hours remote. So that they would be in building on their contracted times, in their rooms, where they are able to distance and have more tools and be able to utilize maybe better tools for the support of our students.
How did that go over with, because I know we've got
I actually
teacher.
heard no opposition actually when I
Well,
talked about that
we
yesterday.
started to get some, but then, and before the meeting started, and I just spoke up with Dr. Mayer and said, we're not going to talk about personnel things in this committee. I don't think that's appropriate. And so then Brian brought it back up a little gentler, more gently. I mean, Dr. Mayer was getting emails before the meeting started about, hold on, and I get it. And so then Brian brought it back up, and it was a little more, it was a better received. Fair enough.
Yeah, when I was on the call probably about 3:01, and it was already mid-discussion somewhat why I got on there.
Oh,
And
okay.
so we recircled back around to starting and then coming back through the document, looking through the document, so.
Okay.
Um,
It didn't meet with any opposition from, like, the health experts?
We sent this to the board. The health department is working on rolling out COVID vaccines and some
Well,
other
yeah,
things. They had
okay, yeah.
informed us that they were not going to be able to be on the call yesterday. Prior, we did send it over to the health department today. I believe Ellen was going to be chatting with.
Tara wasn't in, she didn't work today.
She was not in today? Okay. And I know Dr. Merritt sent that over to the group for them to look over, so we are looking
Okay.
for their suggestions and guidance kind of to come back and to look at those things as well.
Understood.
I really don't see why that would even be a decision or for them to even evaluate that. That's
That
a,
isn't anything for the
For them to
work
be
week is an
concerned.
administrative
Yeah,
decision.
But I
that's
feel like,
exactly.
I guess one of my questions is, I feel like that's something that we need to initiate immediately. I mean, for 3 weeks, we've had 20 hours a week and our kids at home the entire time. We know we can't go to school, we can't even discuss going to school on Monday because we don't have any food. So I don't understand why it wouldn't even be a concern, or I don't know why we wouldn't be able to say, we want this to start Monday, and now for 2 weeks to end our semester, our teachers are in their building, in their classroom, 7:30 to 3:30 to finish it out. We tried it for 2 weeks, 2.5 weeks the other way. Now let's do it 2 weeks this way. That would just be, I mean, I feel like that's something that the board should be able to say tonight, we do or we do not agree, and put that in place right now. Is that not how that works?
the question I have about this is the Return to Learn submitted, Dr. Mayer and the committee submitted this. When we vote, if we're changing it, when do the new changes go in effect? Immediately?
Well, we don't
Well,
vote
the
on it.
last
As I said,
time-
we don't vote because it's a district document.
No, we
But she
vote.
brings
If changes
these
are made, it
changes
comes to us for
and we
our
all
position.
have to submit our changes back within 24 hours. We received this today.
That's not a vote, though. That's
Okay,
just like.
well, after we review them, so then
There
they
we
would be in effect tomorrow.
Well, the last time there were changes made when we reintroduced sports, it was immediately.
Okay.
Should be.
So.
So this will be
um,
Monday, everybody reports back to their classroom after you've heard back from each member, shooting you an email that they agree or don't agree, and then you make the decision of how that change is going to be affected. Like if you're going to leave it in the return to learn. Is that my understanding? That's how I've understood it, I just want to make sure.
I would take it as if it is a board directive to move back to moving teacher schedules or asking teachers to do something else. That would be something that we could ask, of the administration to do, or something we could say we'd like to happen, regardless of revising the plan. Yes.
Can I ask an unrelated question?
We're here for conversation,
Wait.
sir.
Is it, I mean, like, how related? Because I want to make sure we
It's
get
completely
Ellen's taken
unrelated,
care
but
of.
it's related.
Go ahead, Matt, we've
give
already
it a
taken
try.
care
We'll
of
make
it.
sure to come back to Ellen's
The
if we need to.
Excelis, I think is what it
Oh,
was.
yeah.
Oh, yeah, is there training involved with that? If we did this immediate expansion to normal contract hours, would that help with the time for them to prepare for that for a return
I think it
in
would.
January? I mean, would that benefit?
I think it would. I think it would benefit to be able to have the teachers back together for PD, learning, organization.
I had an administrator, a principal of a building, tell me that their biggest concern with the 20 hours is that some of their teachers, the only time they're seeing them is, they're actually not seeing them, they're seeing them through an email. And that's the only communication that they're having with them. And so, as a supervisor, laying your eyes on somebody is really important. And for that employee too, sometimes a bright face from your supervisor gets you through the next 7 or 10 days. So I want this as much for the teachers as the admins, as the district. That's just my opinion, I guess. I don't know how to say that it's I don't know if I'm supposed to say anything else, I guess. I mean.
No, it's fine. I mean, we're just talking about it. So, I mean, yeah, Brian has quite rightly said that it's just a matter of are we looking at Dr. Mayer and saying, hey, this is something that we would support or not, or if it sounds like, here's where I want to take a step back and say, okay, it sounds like what we're looking at here, let me ask, instead of just asserting, what we're looking at here with the draft for Board 12-4-2020, okay? Is this a proposal for board input? Are these the proposed changes? Or are you still waiting on input about some of these items and we should be expecting something else?
These were changes that were talked about and discussed yesterday in the meeting.
Okay.
That you see here. The reason that the chart isn't shown in here is because the chart was something that was a discussion item that wasn't a finalized item. And for us to come up with a way to look at our numbers and to come up with a true cut and dry criteria saying, hey, if we're at 5.5 to 8 or whatever it is that we're going to come back or not come back within these different phases, that was something that was not decided on yesterday. So that was something that was pulled out of the document for you all to look at tonight.
Okay.
So what you see are the things that were agreed about and talked about within the document itself.
Okay, but
And everything that the group saw and everything the group talked about, because Dr. Mayer and I went over the draft, we returned the draft to the group Wednesday for them to review prior to the meeting on Thursday.
Okay.
So they actually had the changes. I had sent them to Dr. Mayer in kind of yellow and strikeouts and things. She changed it to another grid system and added some pieces in. So that is what the committee saw yesterday.
Okay, so this really is kind of a proposal, and I'm looking at you to make sure that we're on the same page.
It is our recommendation.
I do have something to say, though. And Brian, this is no disrespect to anybody, especially, I'm just going to say it, though. This is exactly how I feel when I leave those. We are 7 elected people to make decisions about this district. And I do have a close relationship, working relationship, nothing personal, with Tara. And when you read the letters of Dr. Haug, Aaron, and Tara, it directly made them butt heads, to the point that Tara shared with me this week that it has really challenged their relationship. And she shared with, we met Wednesday, so this was Tuesday. She shared with me that her asking to be on a committee or work with the district was for the quarantine policy in the return to learn plan. It was not to rewrite and tell the district what to do because she's not doing that with any other district in the county. They're running their districts. And so,
Ms. Brewer, I wish you would have told me that. You
Right,
could have
right,
talked to me about
right,
this, you
right.
know?
and so
But
she's,
here
I
we are.
guarantee you she's not watching, but I will share that with her. I mean, I will share that with her.
My heavens,
Um,
yes?
So she doesn't want, and they don't have the time to sit on meeting after meeting after meeting. You guys just heard Brian tell us, we sat there for 2 hours and 45 minutes yesterday, I feel like it was 7 hours and 45 minutes. They don't have the time or the manpower to run their office right now. And I felt like we got a long, extended email from Dr. Haug, and he almost was saying the same thing, like, this is a lot. And so we met yesterday, we plan to meet again next week,
And
I feel like the administrators and Dr. Mayor need to be talking to their buildings, and this plan needs to be developed, and we as a board need to evaluate it and go on. We are no farther as a committee right now than we were 4 meetings ago. I do not feel that, and that is how I feel sitting on it. I want to beat my head against the wall every time we get off. We are not making progress. And this is not, I'm not being disrespectful, I'm not meaning to be disrespectful, but we constantly are having these changes, and it's just a few people's opinions. It's not based on data, it's just opinions. And there's not medically fragile people that work in our district on that committee. I was messaged this morning by a teacher from somebody on the committee that went around and asked all the people at the high school if they wanted to come back to work on Monday or not because she was on a committee. That's not what we asked her to do. And so I'm not going to say overwhelmed, but I don't feel like it's working. I don't feel like and maybe I'm not the right person to be on it, but I don't feel like the right people are working on this plan, to be totally honest.
A couple of things.
Do we, okay.
We got to listen to medical experts. None of us here is a medical expert. We need input from our local health directors, our health experts. I will happily resign from this board if I am suddenly put in charge of making medical decisions. That's not what I am capable of doing. I do not have the background, the expertise to do that. We need help. We cannot do this alone. We should not do this alone. I care way too much about the health of our students and our community to think that I should be in charge of this kind of
And
plan.
that's what I thought the function of the R2L committee was.
She wanted to work on the quarantine policy in the R2L plan, because at that point in time, if you guys will remember, that's what we were arguing about, because we were out of school because we were of the
I
quarantine
remember.
numbers.
I'm here looking in my inbox for it right now. In fact, I got a letter back that said Tara wasn't even the person who wrote that letter. And this doesn't matter. This doesn't matter. I've seen so much. We're updating this R2L right now, right?
yes.
That's progress. We're getting to where we're integrating in new data. We're using new information. We're listening to each other. And just because it's not going one way or another, that doesn't mean that we're stalled out. It's taking time. Things like this take time.
So does our education, and our kids are being educated right now, and parents don't know what this, I mean, this might be a working document, but it's not working right now. We're changing it, and our kids are still functioning as they are. I'm not saying anybody's wrong at all, but
I think that no matter what plan we have, it may not be necessary to have the health department sit in necessarily on calls. But
Correct.
it is important to have the health department look over the information that we're going to use to make sure it is accurate by what they feel should be the direction that we're using within the school system, because they are our health guide within the county. And I believe that they should, however, I need to look on camera and say they make time to work with the largest district within the county. to
I'm
make
not an
sure that-
expert, but I've been leaning on the R2L committee to make these kinds of decisions. I was thrilled that there were medical people, teachers, board members, citizens on the committee. And that committee has given me guideline. I read that thing twice today, line by line by line. That committee has given me guidelines as I'm going to have to vote whether we put kids back in the classroom or don't put them back in the classroom. And I want input from somebody other than board members. So
Fair enough, but it's
keep
gonna be
going,
solely
Brian.
opinion.
Brian, keep doing what you're doing.
It's going to be solely opinion.
Huh?
It'll be
Medical
solely
expert-
opinion.
That'd be what?
It'll be solely opinion is what you're going to get. It's going to be employee opinion.
But
and that's
some
all
of
you're
them
gonna
are
get.
experts.
Some of them are experts.
What'd you say?
In a court of law, they would be considered experts.
But the Saline County, what I'm saying is the Saline County Health Department has not said do not go to school. So why, flat out, and Brian can vouch for
I'm
that.
saying that we're not
They're
changing
flat
the
out.
I don't think they're
We're
going to
changing the
say
subject
that.
now.
They're not going to say go to school or not go to school. but they're
Exactly. So
gonna
what
give
guidance
us-
are they going to give us?
They're going to give us information to make decisions on, and I kind of liked what I read today.
The best part about the entire meeting yesterday was Brian actually bringing up the mitigation
Yeah.
components, because that's actually going to be more accurate
And that's
with
one of
what
the-
happens in our buildings
And you-
versus the county numbers that they're
Right.
not tracking.
Right. I
They
have-
can't keep track of what's happening in our buildings.
I have not liked the fact that we're going to open or close school based on county numbers. We should open and close school based upon our internal numbers, is something that I have argued for.
I can agree with
And
that.
I'm glad to see it's starting to work its way into the R2L plan.
So I guess my question is, Ellen and Brian and Dr. Mayer, you guys are on that committee. The changes that you made just recently, was that the whole committee in on that, or were a few people that actually worked on this plan and put it together and then brought it back to the committee to discuss? I mean, maybe we're not being, and I don't know, I'm not on the committee, but is the committee just not being productive during the time? And it's actually a collaboration of a few people getting things done and bringing it back for conversation. And if that's the case, then maybe those people need to work on it and just continue to do that, and, keep in touch with the health officials to get their professional advice to help implement what we need for the document. I feel like I'm getting the meetings aren't being stuck to an agenda and in a timely fashion, that there's just a lot of everything going on.
Well, like our meetings, when there's conversation about points that people want to talk about, there necessarily isn't timelines or driven down. The meetings are longer than ever intended. I didn't intend for any of them to be longer than an hour. Our board meetings, I don't intend for them to be ever longer than 2 hours. And we're here for 4.5 hours.
Don't look over here.
a night.
Don't look over here.
So, I mean, an agenda is an agenda only to the point where when you're looking at a document that is 40 pages long, even though I cut it in half, there's two 20-page documents here. There's 20 pages of what we came back to school doing. There's 20 pages of what we need to do as a district. So when you're reviewing 20 pages with 15 different people or 12 different people on a call, and you want to give everybody a chance to voice, it takes time. And there's going to take
Absolutely.
time. There was
Absolutely.
a
It's a
lot of
bureaucracy.
productive conversation yesterday. There was a lot more acceptance than I thought there would ever be on some of the changes that were offered and some of the things that were said yesterday.
I'm not sure all of that was understood, though. I mean, I don't know that all of that was understood yesterday. I just wonder, one of the things that Brian and I had talked about, we talked about this on the meeting yesterday, was to incorporate maybe some community members through some sort of process into this committee to bring another insight in. I'm concerned. I appreciate that we're making changes. Don't get me wrong. I appreciate that we're
But
making
there's gonna be
changes.
more
But the
opinions.
fact of the matter is, excuse me?
But you've said that the problem with the committee, or with the working group, is that it's just opinions.
It is.
So then now we're just going to have more opinions?
It is. I'm going to be, I will lay down dead in the middle of the floor. Yes, it is. It's opinions.
So now it's just going to be more
And
opinions.
so,
I'm
it's
just
opinions.
asking.
It's opinions. It's opinions. It's what somebody thinks they can live with on this document, and that's it. And if they don't like it, or then we go that route, or we go this route, or before we got off the meeting yesterday, it was like, what are we asking the board to do? And it was like, it was almost the opinion that whatever they say goes. Well, they don't speak for everybody. I mean, there are very choice few hand-picked people. I as an advocate don't feel like that group truly is a true representation of the district. I know it's not. I know it's not.
Okay,
And so it's just, for me, it's a bit uncomfortable, and it seems slow moving. That's it.
Well, it's a bureaucracy, so it will be, and committees, by definition, always take a long time.
And it's deliberative, but we need to have other
Okay.
voices. Yeah,
So here's where I'm at, Dr. Mayor. You sent the email, I just looked it up at 11:09 a.m. this morning. You'll have my response by 11:09 tomorrow, so you'll know whether to move forward with this plan. My question is once everybody's responded, we will know that this is in place for Monday. But the question, I guess the teachers, they know that they're going to school anyway with 20 hours, so they'll know whether they're reporting to school 5 days a week, Monday morning, or by tomorrow. I mean, you'll probably have to send an email out over the weekend to make sure that they report to.
I think we probably ought to tell them they need to report on Tuesday. Because some people, when they leave work, and they
Right.
don't look at their
Isn't that
email
nice?
until 8 a.m. on Monday morning. So, I mean, it would be fair.
In all
I think.
fairness, I can accept that that's fair. That way they know, they've got their email, it's over the weekend.
Right.
Everybody reports to work
I
Tuesday,
got
and
a
then
point,
they're
too.
going forward. Question, go ahead.
I got a point. I was sitting there thinking on, and it goes with you, when it comes to the percentages, we know it's at this amount. Do we know, do we have a projected date that, or know a percentage per day that's, how much is dropping per day? So we can give this community, hey, you can, the way that's projected dropping or increasing, we're kind of maybe looking at this date and we stick to that. Because these people are all confused.
Well, Ed,
We're either going to school or we're not. I mean, it's very simple.
And that was a
but
large part that
there
was
ought to
talked
be a
about on the
projected
committee.
date that someone could tell us, you know, I'm sure they got data saying, we have this many positive, this many mitigated, you know, if the trend keeps, you know, you're gonna be at lower at this level. I know we're not using them numbers no more, but it gives us a little something to bite into.
So there's a few things that I have talked about also with Dr. Mayer, that before we had put the dashboard out. The dashboard reflected community numbers, and I think that our dashboard should reflect school information,
Exactly,
period.
just like Harry's.
We should have
Exactly.
school positives, we should have school quarantines, and we should reflect that through the percentages of our populations of students and employees.
Okay.
Whether we break that down by students and teachers, or we break that down by true population totally overall.
Anybody
Because
comes
that gives
into
us
our
a
building
picture
should be
of
counted.
I
what
think it should be
we
adults
are
and students.
necessarily versus what the community is. Because our school community is different than our community. We have far more mitigation strategies every single day kicking off at 7:30 in the morning for getting picked up on the bus than anybody else does walking into their job probably.
Ain't that the truth?
And you can go into Walmart where I see kids now at 11 o'clock in the daytime, 1 o'clock, and anytime I go in there, some of which aren't using masks, some of which aren't social distancing, some of which may or may not have washed their hands as fast as I know the things that are going on within our school buildings when we're saying, hey, you need to wash your hands when you do this. Hey, we've got kids in here that are 5 years old that are wearing masks because that's what they're asked to do all day long, and teaching them to do that. So we've got a lot of things going on within our school community that they aren't gonna get in the other parts of the community. And like we talked about, like our parent groups talked about, you know, we've got mitigation strategies and our school districts have been holding it up. We've been doing our end.
And it's worked. I mean, you got the CDC saying, yeah, you have the governor saying, yeah, send them back to school, and we're lollygagging. I mean, we just need to come up, look at the numbers, it's dropping this percent, and I don't have a PhD.
I don't think you can do it like that. I do want to,
There's gotta be some way
I-
to give this community, you know, to kind of let them know, hey, we're gonna be in school on this, you know, try to hit this date. You gotta give them some hope. I mean,
So-
and it's safe here in school. And Harry's 100% right with the data. It shouldn't be Saline County. Anybody comes in our building, they should be counted. Anybody that steps foot in our buildings. You know, it don't matter if you're a teacher, you're a kid, or you're a custodial, whatever. All of them should be counted, and everybody else's should go away. So basically, if you take the county's numbers versus ours, it's gotta be less,
ours are less.
a lot less.
Yes, absolutely.
So-
But, for instance, Brian and I asked if Grace would share the numbers with us. The nurses turn those in every Friday. This week, they turned them in on Tuesday because they weren't here on Friday. And yesterday in our meeting, we talked about sharing those with the nurses. The document that we were shared with has them by building, and it's a very nice document. And so The nurses update that on Friday. So it was, my question in that group was, can we give that to the community? The secretarial staff and the committee was like, absolutely not. My phone calls will increase if you give those numbers to the community. I have an opinion about that, I'll keep to myself. But I will tell you this, our numbers in the district right now as of Tuesday are higher than they were last week. We have more staff positive, we have more employees in the district positive this week than we did last week. They aren't spreading that in the schools. They haven't been here. We were gone for Thanksgiving. So I do want to say this. I got an email from somebody on the committee. It says, I feel as though if a report is going to be presented to the board about the Return to Learn Committee meeting, that the true report is given. It was stated that nobody opposed the teachers coming back in 40 hours a week, and I specifically stated that it was unfair to our teachers to expect that, and to help those students who cannot make contact during the contact hours. It's fine if I'm outvoted, but I represent my staff, and I cannot sit back and have them think that I did not fight for them.
I got lost.
I don't,
Pretty down for
did somebody say that?
There was a comment, yes.
There was a comment?
There was a comment
Yeah,
of the
but
group
no
of
one
12
said that
yesterday or
that's not
10.
true.
This is exactly what I'm saying about this committee. Like, there's so much power. I mean, I honestly feel like if you sit on that committee, it is perceived that you have all this power and this perception that you are making the decisions, and whatever I want, by gum, we're doing it. And so I appreciate that she'll send this message to me, because she's having to, I mean, she's a secretary, she's having to hear it, she's getting it from every angle. That's my point. That's truly my point.
Okay, so my question is, because we went back to this like 2 or 3 times, so
Yes, ma'am.
what are you asking when you have brought that up?
Exactly what I said.
So are you saying what do you want done with that? You want to diminish the committee? Are you wanting to?
I would like to bring it back to, I would like to hear.
Administration, because you
Yes,
mentioned
I would
administration
like
to take it over.
I mean, the principals are running their buildings. They're in their buildings. They're doing it. I mean, we've completely taken them out but one. We have one principal in the group. And so we're not hearing any, I don't know. I just feel like we're getting lost a little bit, honestly. And I feel like Brian and Dr. Mayer, and I've added some input, but not as much as them. I mean, they're working on this committee and they're working on this plan, but all the changes they're making and then bringing it to them, and then there's some discussion, but it's very slow. And I think after the communications that have gone out with, the Return to Learn Committee's meeting, and we're going to have answers, I think it's misleading. I think it's misleading when we talk about working together and being forward-thinking for our kids and our families. I don't feel like the plan is forward-thinking enough, if that makes sense. Our parents can't go to this plan and really feel a comfort and I know we're working for it, but if this is our plan and this is what we're using right now and we're educating based on this plan, then we got to roll with it. We got to have something solid, and we don't. And even with the changes we make tonight.
The plan is not an education tool.
Right.
What'd you say?
Yeah.
The plan is how we're going to be in district.
Absolutely.
It does not talk about curriculum. It does not
I'm not
talk
talking about
how
that.
education's
But
gonna
if my
happen.
kid's at home on the couch under a blanket being taught 1 hour today versus in the building being taught 6 hours today, that's a big deal when it comes to this plan. And her education is way
That's an
different.
instruction problem. That's not
And
necessarily a
it's,
plan
and
problem.
it's, yeah.
And
But
that's
are
the
we going,
difference.
but when are we going to school? How are we going to school? What are we doing in school? That should be in the plan, and that's not what we're doing.
So
My
on the
opinion or
plan
my
itself,
feeling?
I mean, are you requesting that the committee change? I mean, or just, are you done with that? Or, I just need to know where we're going. Are you?
I'm just asking for some consideration and maybe guidance in how, I wanted to be honest with the board about what Tara had told me, truly, because this is the second time she said it. I've sat in a meeting where the medical professionals haven't, and now I've gotten an email where the medical professionals aren't just being medical, they're being political, and it's inappropriate, and it's disgusting. And so I don't think that committee is a platform, and while we love their opinion and their medical opinion, I don't need, and we are getting their political opinion, and I don't like it. And I don't think this board should be swayed, or the decisions we make should be swayed by a political opinion. And that's, I wouldn't have probably gone there, but you asked. And so, I don't know. I don't agree with it. And so, that's all I want to be clear about, and we can move forward. Doesn't have to, nothing has to be done. I'm not necessarily asking anything to be done. I'm just being transparent with what I feel
Okay,
and my
so,
experience with it.
Is there anything in this plan that is swayed by what you feel is a political statement?
I feel like there are things that have been, decisions that have been made in that committee that are
In the
politically
plan.
based.
In the plan, not decisions or discussion.
Maybe. I mean, well, it depends if, I mean,
So,
so while you're looking, let me go to page 16.
I mean, I have not,
No, I'll
I
let
got
you
this
look
this
at the
afternoon
plan.
too. I haven't seen all the changes that were made because a lot of this was written in here this
Right, I
morning,
mean, like I
so.
said, it came through today, so I had like an hour in between snacking.
Yeah,
to
I
get
didn't even
here
have
to
that much
read
time,
this,
so.
Okay, on page 16.
yes, ma'am.
There is something that you guys are looking into, a supervised school-age daycare for your employees. So I wanted to have some discussion on that, because if our kids aren't allowed in school, and I know we said that we could let the kids come with their parents to work, but I want to play the devil's advocate on this side, because if we're not letting the kids in school, why are we gonna have a daycare in school?
That
So-
was a conversation that came up yesterday. I actually came up with that, and I actually presented that idea as we were talking. There were some things that people were talking about that said, what are our kids gonna do? My true feeling was, I've got employees that have to figure out what their kids do whenever we have to go back to school.
Yeah.
You know, that you're gonna have to make arrangements for your children as well. The softer side of what can we do as a company, as a business to support our employees better, is we do have personnel that necessarily aren't needed in their current capacities that we have charged ourselves with still paying. There are parents, there are other people that don't necessarily have a task of education and instruction that could possibly be tasked with looking at this. I asked for numbers from different buildings. What we got roughly was there were about, it sounded like 40 or 50 kids throughout the district that were about all that were coming to school.
Okay, so I gotta do this again, because now they're allowed to have in-seat learning with a para, like a teacher. Our other kids are not allowed to have that. So I'm just playing both sides here, because honestly, for the great teachers that, you know, are bringing their kids, and this is an opportunity, and it's a benefit. But I'm gonna sit here and say, what about the parent that cannot have their kid in seat, and they need the resources, and just like social division talked about, you know, abuse and those things. We've got kids that are in those situations, and then we're doing the extra over here. Now, I'm not saying I'm sitting on either side of this. I just want to put it all out on the table, because I think we need to think about those things as we make a decision.
We do, and that is definitely something that you need to look at and see whether you support that or not.
and so would that be something that we,
That was only a proposal, that wasn't.
right, so that's not something that Dr. Mayor needs
That
feedback
gives
on
you
today,
till
right?
11:09
It
tomorrow
says
to say
they're
strike it
looking
or not.
into it. It just
Say now
says
what?
looking into it. It's
That
not
gives
even
us-
in the plan.
that
It's
gives
not
us
in
the
the plan.
24
It's
hours
just
to
something
say
they're
whether we agree
considering.
with that statement or not as a group at some point.
It
I know,
just
but,
says they're looking into it.
right, so is that something that we're weighing in on right now, or we're saying,
That's something that you
We be
should
quiet
weigh in.
about.
Everything
It
is part of
sounds
the
like-
draft that you can weigh in on and say
Yeah.
whether you agree with it or not.
okay, I just don't know if I didn't say something, oh crap, I forgot, Dr.
So
Mayor, I
Brian-
forgot that thing. Am I
Yes,
late?
sir.
What
the
is the
7th?
exact criteria it's gonna take to get our
Did you
kids
see my
in
mind
school?
just flip?
What benchmark do we need to hit?
I'll do it tomorrow. Oh,
For our
it's
kids?
tomorrow.
This is what the community
So,
wants to know.
so in order for us to have a
I'm sorry, I
benchmark
forgot.
or some kind of a formula that
Okay.
we're going to marry, just like we were married
Okay.
to the last formula.
I'm so sorry.
I put that out to Jim and Travis to look into because I am not a mathematical guru. I am not going to crunch those numbers, and there is no formula that is currently out that Dr. Mayer and I have seen that pretty much puts us back into school as we are somewhat. You know, but we aren't looking at the mitigation strategies, and I looked through the CDC site, I couldn't even figure out what they're even saying with the mitigation strategies. They say on there, if you have these in place, then you're doing a better job. But they don't break them down into the table. There's probably 4 different tables if you go to the CDC page about how that formula actually works in different parts of it, and the extensions. They shortened it into the one that we have. And looking at community spread is one thing. If we look at our school spread, maybe that's something else. You know, we did put the 10 and 15% later on down the document months ago when we figured out those were kind of threshold numbers for us to have safety within our buildings. If we've got 10% of our teachers out, then we can't function. You know, if we've got 15% of our students out, then we were shutting back down within those phases as well, as it's listed on whatever page
So
it's
if
in there.
we had
exactly.
that data, we could basically have an idea about when you can return to school.
So-
If we have that.
We have
So
it.
the
right now
data
we
that
have-
I wanted to see was, what did it look like for us when we were having the same problem in October? What were our true numbers then in school, not in community, but in school?
Not, okay. Did
But
you
we
have
have
those? I didn't see them in the document.
They are
so-
not in the document because that
So
was
what
the
did you
way that
find,
we kinda
Brian?
came
Because
up
you're the
with.
one working on this.
And I
thing.
haven't came up with that, that's why
We have those,
crunches
though.
numbers faster and better than I ever could. And.
We
by
have
the
those
end
though,
of-
right? I mean, I
Yes,
have
we
them, I'm
those
looking right at
numbers.
them.
I just didn't break them down and
Yeah.
take them all out by
Yeah.
a mathematical formula. Because I thought if we tasked him with something like that, then he would give us a much better representation like he normally does with data.
So, another question. So SEC has been back in seat for several of their classes since when? And those are small groups.
Who has?
SEC?
I think that was November 23rd.
So Monday?
Last week, wasn't it? Or before Thanksgiving?
It was the day after, wasn't it the?
It was the Monday following
After
Thanksgiving? Oh, no, it must have been before
That
that.
was the Monday before Thanksgiving.
Maybe. It was somewhere
Okay.
real close.
So this week, last week,
Partially. It is not full, it is
no,
partially.
but it's small groups. Small groups are attending in-seat class at SEC currently. Last week, SEC did not report any positives in their building. This week, they report 3 adults positive, 3 quarantined.
SEC.
And so my question is, the Career Center, Harry. My question is, if we can go to SEC in small groups, what's the difference in activities and athletics and the robotics teams and things like that going in small groups? Why can't they be participating? One of the things that we talked about on the committee yesterday was that, and Rosie brought it up, that the high school couldn't, if we go back 5 days a week, full kids, that they have no room to social distance. And so the small groups was an argument there. Well, then I got to looking and I got to thinking, well, SEC goes back in small groups. And I looked at, the coaches gave their administration, the athletic director and the principal, a plan on Monday of our last board meeting. As of yesterday, Dr. Mayer the high school administration hadn't shared their plan and their proposal with them, with Dr. Mayer, which I don't think is totally appropriate. And they were told that it needed to go to the Return to Learn Committee, which I don't understand. Anyway, and so my question at this point is the coaches have put together a very reasonable plan to safely bring their kids back to athletics. And I want to know if we can have SEC in seat small groups, why can't those coaches be in their classroom in those small groups? Just asking. I have no dog in the fight. I don't have
Will
it.
those athletes, will the basketball players, the cheerleaders, the wrestlers, all them, will they have masks on all the time?
I mean,
Wrestlers won't.
only, they would just like fall sports
I mean,
and robotic. I mean, I'm talking about, like the robotics team, they're missing out. They should have been at meets. So I'm not talking about.
I'm just asking if we're saying all across the board, all small groups, are all small groups going to be equal? Will they all have masks on?
The
Except for,
question
I mean,
is what do you consider a small group?
Well, okay, so if we have 10 basketball players
Okay.
practicing, and we have 10 at the Career Center in
If we break them up
automotives
in
or whatever,
tens.
will both groups have a mask on? So they're not really equal.
Yeah.
No, because sports, your basketball player's not gonna wear a mask running up and down the court.
I know, that's what I'm
Some
saying.
do.
Wrestlers not go, no, they're not.
yeah, they are. I watch games every day that their kids are wearing, some of them are wearing masks. Yes, they are.
And the wrestlers are not gonna have masks.
They won't.
Right.
First thing we'll do is rip it off.
So,
I'm just asking that as a consideration of this group. There are
thought
teams
there
that are
was a-
playing in our county. All of our
Well, in
conference
this
teams are
plan,
playing.
it says,
It was in the plan.
But the plan's been changed. That
Yes.
plan has been changed.
the facilities are closed, for all public events. So what, when you crossed out school, what were you indicating that? What is that indication that you crossed that out?
So when we talked yesterday in the committee, I had a bullet point that was on there about participation in events. Prior in the fall, when there was prior to a football game, the board voted to allow the students to participate after hearing from the students at that particular time. I wrote something up that was very similar to that same type of situation. The email that Ellen's referring to, the coaches had kind of got together and submitted a plan of, freshman boys will practice together. JV boys will practice
Okay,
together.
but this,
Varsity will
is
be-
that what you're referring to in the plan that you crossed out school? That's what I'm
Yeah,
asking you.
I think that school events are okay,
Right.
but outside events, public, outside groups, we will still not allow that.
So when you cross this out in phase 4, we are allowing sports in small
Yes,
groups. Is
that's
that what we're
correct.
doing? I just want to make sure that I understand that
No.
bullet point. What-
No.
So what is that, Brian? That's what I'm
No,
asking.
No, we took school out of that because we weren't sure what was gonna be decided through the board. Because the board decided to restate athletics, then it had to come out by saying school. What we said is that we would not be opening our gym to community events based on community spread and inviting more things into our buildings. Just like we say in phase 4, we have no spectators within our buildings for any events that we would host or have.
Yeah.
So
But
that is where that is
But
coming from.
on November 10th, when the email came out, the email snapshot came out from a district employee saying that Dr. Mayer had decided to go distance, our return to learn plan in phase 4 stated, myself, Coach Phelps, another family, we were all sitting together, it stated that there would be no spectators. It did not say we would not have any activities or athletics. So that has been changed. I don't know who changed it, but we found it in the plan on November 10th on the website. So that has been changed because it's not in this anywhere else now. So I don't know who changed it, and I don't know when they changed it, but on November 10th, our phase 4 said no fans. It just said, no spectators and no fans, but it did not say no activities. And then I have an email following that we have gone to our administration and asked them, do you want to have athletics? And they stated, because of their opinion, it's not safe to be in schools. Why would it be safe to have athletics? So then that's when I requested the district numbers so that I could see, do we have a district COVID problem or are we closing because of a community spread? The kids are not the ones that were positive and the reason we closed. So we closed and sometime, somebody's changed this plan. On November 10th, it was written in there. So
No, it's, no, I'm confused. There was
I think it was
always
when
general
school was closed,
consensus
since-
that if you're not going to school, we're not doing sports.
that's not what the plan read, though.
The plan, I don't believe, ever specifically said nothing about no sports.
Yeah.
My
I do
point.
not remember.
But
My
that ever
point,
being-
it said no spectators in phase 4.
It said no spectators
So that
because
needs to
that
be
was the winter
clarified.
sports guidance
Yeah.
that was added to the plan around that time. And at the
So-
time, we were still in school, and that was another unforeseeable change that was going to
And
occur.
winter sports are a lot different than, fall sports are a lot different than winter sports. we can't.
That was the conversation also
So,
that I had
Doc-
yesterday.
So-
They're more open air, but there are also full contact. Football by no means
Yes.
is not a not up close and personal sport.
I agree.
So,
And
Dr. Mayer,
there's a lot of people out there, excuse me.
I'm sorry, Dr. Mayer, so sports, I think we need to clarify that in phase 4, where we stand
Well,
and what
I
needs to
think
be
that-
put in that plan.
I
And
think the
what-
difference is that in the plan before, there was the grid. And in the red grid, there are no sports. In this plan, there's no grid.
Okay, so it's not written, it was on another, it was on a,
It was in the grid.
It was in the
and
grid.
It was.
No, that was the fall direction from the NCMC. That was the fall direction in the conference. And the athletic director flat out told me there is no winter guidance from the conference on no sports. Therefore, all of the teams in our conference and all of the teams that you see all around us, Boonville,
I think what
Sedalia,
Dr. Mayer is
Pettis,
referring to is
Hughesville.
we had a chart
That
before
was a fall sports guidance from the MCMC. There is no winter guidance from the NCMC. The athletic director at the high school told me that herself. So that's,
Okay, so that might have been a misunderstanding or a misconception that was, on that guide.
I
I
thought
don't
I
know
read
what
it
it
in
was
the plan.
standing for, winter or
Wasn't it in-
fall.
is
we
it
had
in the
two.
plan?
There were two charts.
I don't remember what exactly was in the plan. I've read this
I
plan for so
couldn't
many
come up.
years, it feels like.
Years?
But it feels like years. But I know that we had asked Ian and Kristen specifically
Okay.
when they were here before, how they felt about.
And they thought that when
sports.
schools closed, sports are closed.
Right.
what
And that
I-
is how we arrived at not having
Then
football
I think people
going on at
That's how I
that
remember,
time.
that's how I
And we
remembered
had
it,
canceled
yeah.
things, and then on that Monday meeting that we had, we decided to allow play to go on Friday. I believe it was a Monday special meeting that we had that week, Monday or Tuesday.
So
Well, I
where
think you
I'm
had a
at
Monday
is
and a
that just
Thursday
needs to
that
be
week,
added to
right?
the plan, and we need to know that update. Dr. Mayor, I just think that whatever that is, it needs to be in the phases.
So-
And we need to know that to know if we have any input, since we do not have any clarification.
Exactly what are you asking of me
So,
here?
Dr. Mayor, remember when I had we had that bullet point about sports participation and following the guidance of someone overseeing that program? We had talked, who would be somebody that could possibly oversee? We talked about that. I believe there was a suggestion of possibly Dr. T, there was a suggestion of the ADs, and then we talked about who actually has some expertise actually being able to know what safety. Basically, it's gonna come down to numbers. If you've got kids that are COVID positive on the team, then you're gonna have to stop practices, you're gonna have to do it other ways, you know? So that was where it was. So.
Is there Misha guidance, Brian?
Excuse me?
Is there any Misha guidance right now? I mean, has Misha put anything out
I
on
have not.
COVID
Well, I'd hope
response?
that whoever's on that would actually refer to their documentation for support. So if it's the AD and then her supervisor reviews it for input and then presents it to Dr. Mayor, I would hope that they look for
This will not
resources.
turn off.
The winter sports guide is on the top of page 13.
But I'd like to get back to where Ed was, about decisions. So, Dr. Mayor, we are currently at distant. What decision, I know that you had sent an email out stating that that decision was going to be made Thursday, today's Friday. Where are we at on that decision for distant learning or in-seat? What decision have you
Well,
made?
I thought that I communicated that the recommendation would come to the board. And the board then would, because I said we needed a collaboration between administrators and the board. The administration is making a recommendation to the board. But just like when we had sports and they were reinstated, the recommendation for the administration can't be the final thing. It has to be from the board.
Okay, so what is your,
So my recommendation
recommendation.
is what we came to yesterday, and at the very end of the meeting, I said, so this is our recommendation, to come back to school. I said January the 11th, but they all said January 4th is plenty of time. So come back to school in seat with sports, et cetera, on January the 4th.
okay.
Okay, now,
I cannot
one
turn this off, I'm
question.
so sorry.
Has this been addressed since, I'll probably burn
I don't know, it's just,
car up tonight, but
Not that loud.
what about summer school and extending, because our kids are, basically they're losing out on their education. Is there
Yeah,
anything impossible where we could, and I hate to say it, summer school for all, so we can try to get caught up?
Add a week or two to the schedule, is what you're thinking?
I'm
I've
just
been
saying.
expecting for Desi to step in with some
Say-
kind of guidance
Yeah, we
about
can add a
what.
week or so.
I don't think we're going to get guidance from the state level.
Wow.
I think they've given it. I think they want you in school by that last,
But I mean for after, you know,
Normal
like,
school
Yeah, I mean,
year's
I-
up.
yeah, exactly, after the normal school year's up.
I think, honestly, nothing is off the table right now. I think an extended summer school is a good idea.
Well, I know they'll probably be ticked off of me saying that, but
But summer school has been increasingly popular in the district.
Oh, I used to teach it all the time.
So I
love
do
it.
believe that because we have not been able to, we don't have enough food to feed our kids. We don't have enough milk for our kids. We couldn't do that until, we had to get that word to Jennifer yesterday afternoon, and we could not do that. So right now, this moment, we can't get food in the district until the 16th. Well, we're out on the 18th. So even if we could get food in the buildings on the 10th, we'd be coming back for 4 days right before Christmas.
Well, yeah, that didn't make a lot of sense, I think.
So I just think we should stay in distance learning until January 4th. Well, we'll take the Christmas holiday.
And that is
the
your
Christmas break.
recommendation, that's what we have to vote on, am I correct? or
No, we don't
am I-
have to vote on
we don't have to vote on it?
That's
Well,
not-
So I have a question
Just
though.
wants input.
So we have, and maybe it's not appropriate for me to ask this, but I'm gonna. The parents of the district have done and have said, okay, we're doing whatever you want, Marshall Public Schools, this entire semester. Will you listen to us for next semester? And that's what they were here asking us tonight.
That's what some of them were here asking us, and I've got
Well,
just as many
school.
emails in my
I get
inbox
that. So
saying
do I.
otherwise.
Yeah,
And I got 8 emails from teachers saying, please send us back to in-seat tomorrow or on Monday.
And
And
I've
I got
got-
5 saying the opposite. So I think we all are gonna have, I mean,
No
you
matter
know,
what, we're
it's
gonna have
gonna be all over, that's gonna be all over the place.
Yes.
Just go, we can't do it, we can't feed our kids, I
Yeah.
mean, they're not.
No, I'm not asking to go back Monday.
But I'm
My question
saying
is,
that there's no
are we
way.
ready to,
January 4.
And let's stick to that date,
Let's
that's
stick
it.
to the seat.
Now,
Yeah.
Stick to the
Decision
seat.
made.
Okay, but here's the problem that's been frustrating me, and I think I've already
In-seat
said it
out.
once, so I'll say it again. In-seat, out-of-seat.
Yes.
In-seat, out-of-seat is no good for our kids. It's no good for our teachers. It's no good for our parents. Now, I don't have the solution, and I'd throw it out there right now, and we do it. But
I have to say, some of this turmoil, not all of it, has certainly been kicked up by, waiting to make announcements or,
Yes.
and so giving people a date and sticking to it.
And then if we go back
So
on
let me- go ahead.
January 4th, and then we've got, I hate arbitrary numbers.
Sounds
And
like
if we go back January 4th, and we've got these arbitrary county numbers that are spiking, yet we've still got teachers and substitutes.
It sounds like we'll have
Why
more
not?
district-sensitive
Why not?
numbers.
I would rather see the kids in class than
Yeah.
walking around
Yeah.
playing basketball, riding their bicycles when I drive down around town, and when the weather was nice. I don't know what they're doing now, they're probably inside playing video games.
Hey, parents,
Well,
encourage
if
your
we
kids
were-
to
if
log
we were
in.
So-
back- Let's say January 4th, it's here, boom, our kids are back in, we're doing 5 days. You get 10% sick, leave them home, keep the other 90% in school, I mean.
And we
That's
are
what we do
working,
during,
This is my
even
point.
before COVID, what happens if the kids had the flu? They stayed home, I mean.
and we are working
just need to
building
kinda
by
work it
building.
that
Some
way.
buildings might be
That way
better
we
off than
keep our
others.
kids in
In
school.
So, Dr. Mayor, Harry and I was speaking prior to the board meeting, and he was touching on this, and this is kind of, and I think Aaron was getting ready to. When we say we're going to make a decision, make the decision. We're here to support that decision. But most importantly, our parents and our kids are getting stressed, wondering when that decision's going to be made, or if that decision, or what is that decision, and when's the next decision, and how many decisions we're making, and they're feeling like it's an emotional roller coaster, and I think that that's playing a part in the whole situation too. So what I'm asking of you is when you make that decision, make a solid decision, and when you have a deadline and you say you're going to do it, do it. And
Well, and I would be happy to do that, but that has not worked out well for me.
Yeah.
That hasn't worked. And so I would ask the board, if I make a solid decision, am I going to have the board behind me?
And I know that what happened in this past time was that Brian said, hey, make sure you get in touch with Aaron about this before you before. And in fact, I remember saying earlier that day, I doubt that Dr. Mayer would just go out and make a decision without first saying something about it to the board. I was thinking it would be like the form of an email. And it was, and that was just the most unfortunate situation and timing. And so I'm going to come right back to where you're going because I'm with you on it. The timing that was bad was that I was stuck in a training until late that night. So, and I didn't have my phone on me at all. I had no communication. I was in a training. So it just ended up being the worst circumstance for getting quick feedback. So I think what Christy's saying, what I would echo, it sounds like Harry's on that same page with us too, and I'm going to put it out there and see if the rest of us are with that. Yes, if you're going to make a decision about, if you have a decision to make and announce about when folks are coming back into in-seat learning or going to distance, please go right ahead and make it do.
I just have to say, I've done that 2 or 3 times, and it has backfired on me.
I think I see what you mean.
I do not want to do that. If the board is going to come back and.
No, you're right. I see what you mean. I
And-
remember it.
And that is why I kind of, Dr. Mayer said, okay, the committee's met, this is the committee's recommendation.
committee's got
Who
it
do you
in
want us to
there.
go? And I said, hey, make sure that everybody understands what we got going on before somebody says they didn't have any idea what was going on.
And so maybe the problem was that it just came to me and it got bottlenecked there.
I wasn't lying.
I wasn't either. I didn't get the email.
board members didn't
And when it said I was informed, I wasn't
technical.
informed.
Well,
And
and that was not my fault.
No,
I mean,
no,
I got blamed
no, no.
for it, but it was not my
But
fault.
let me-
I'm getting
let me go
screenshots
with
of that
that.
email, and I'm like,
Well,
look.
and the thing
But what happened
is
was
is
that
when
email
happens,
said it was
then the
informed.
board- I would expect the board members, when that happens, to say, I'm going to check with the superintendent, because I doubt if that was intentional. But what I heard
no.
was that, oh, well, you're being blamed because they know that you meant to do it that way. Oh, my God, are you kidding?
No, that.
I never
The
said that.
the only thing I had a
That-
problem with is that I got it secondhand, and it said I was informed, I was not informed, and even your email that you sent out to everyone said informed, but we should have, if it's past tense, then I should have already had another email being
Okay,
informed.
see, that's why I do not want to
So,
make.
but that wasn't anything to do with
No,
what my
yeah.
statement, so we went sideways on that. That is not anything to do with the
Okay,
statement.
okay,
My
I
statement is,
understand.
Dr. Mayor, that when you make a decision and families are depending on that, and we're going back and forth, making decisions a couple times a week, like if you make that decision and you say we're in seat or out of seat, and we are out of seat or in seat until X date. Like, that family is looking for that, not a roller coaster all week waiting for the next decision,
I-
and the next decision
I will
in 3
be-
So
weeks.
we had this
Very happy to
conversation
do
on behalf of, in her defense, Brian and Dr. Mayer and I had this conversation last night because I read an email and I read it to say that Return to Learn would meet Thursday, she would notify the board and people would be notified, And so I asked that in a text with those two, because I thought, if we do need to get that information out tonight, if that's what everybody's perceiving that email to mean, then it needs to go to the board tonight before, I keep hitting that, I'm sorry, before she puts that out. And so I appreciate the
Yeah,
position you're in.
I'm not putting it out unless the board tells
Yeah,
me.
I mean,
Okay,
So
so,
to get off of this and to go back to the yo-yo thing, that was something else that we talked about yesterday on the committee, and we've talked about across the district, our parents and our students. I believe there was some communication with the student body president. There's been communication with the teachers. We just want to know if we're here or if we're here.
Right.
And we want to be able to ride it out one way or another. And we're going to have to be able to get there.
That is fine. I will be happy to.
No,
make
I
that
don't,
an
I don't mean that in a negative way toward you. I just
yeah,
meant, that's
no.
kind of what the statements have been.
Well, I
And
think
what we
it's-
want to do
and
now.
you know what, it's just one little thing they're trying to help with their emotions and stress.
yeah.
And
it
it's
is.
nothing on you or anything, it's just stating
It
that
gives me
they
emotional
think.
stress.
It gives,
Yeah,
Right now.
it gives
they're
the
just
kids
saying
emotional
it would be
stress.
helpful for them to
It would be
So-
helpful.
know a decision and a date.
So what we're
I
saying
done.
now is
I
that we will
agree with
return to
that.
school on January 4th, if that was agreeable with the board.
But I think we need to be careful how we say that. We are going to continue in distance learning. Yeah, we are going to continue.
Well, that's not.
That's
what
in the
they
calendar.
say.
Not on a tentative date.
If we announce it that we are going back, we say, as of right now, tentatively.
We can't say tentatively.
No,
They don't want
I think we
tentatively.
need to
They
draw the
want-
line. in the
People
sand.
don't want to be tentatively in a seat,
Well,
because
here-
that's the issue.
But here's my question. So Matt, are you saying that because the tentativeness is, it has to do with our
District numbers.
No, because it has to do with perception of how people read that.
Oh,
So
okay.
like right now, I got a message saying we can't go back Monday
Yeah, that's what I'm
because we
saying.
don't have food. Now, no one said we were going back Monday. We were talking about the teachers going back Monday, and it's already been misconstrued.
No, I think that was said before. We hope to be able to go back.
NC learning January 4th.
I mean,
Yeah.
I'm just saying,
Yeah, that
you know,
was,
Yeah.
It's open session.
We're still
Okay.
open.
so,
I think we're making progress.
we're making progress.
Yeah, right? You didn't,
January 4th.
the parents are frustrated, the teachers are frustrated, I know the kids are frustrated.
I'm
I
frustrated.
have 3 of them, and, admin's frustrated, we're frustrated.
It's
If
just
we-
a stressful
you know,
thing.
It is.
We can say that,
Because the soonest we can go back and it make any sense is the 4th.
Yeah.
Correct?
But we keep saying that, but our kids are gonna be distance learning still on Monday through the 18th.
Yes. We can't
Yes.
help that. because-
For sure. I'm perfectly fine with that. I am not in favor of our kids going back to school on Monday. The high school kids then would go back, or we would have to go back Thursday. The high school kids would be in school 3 days
Right.
before the 18th.
Makes no sense.
No, that's absolutely asinine.
Thank you.
So, but I've never, it's asinine, but if they could go back Monday and be there 5 days a week, then fine. But we can't do that. We can't do that. We don't have food, move on. My point is if we say though, school is coming back January 4th, some people are going to say, no school? No school period? We are still having school, distance learning for 2 more weeks.
That's what I meant.
You with me? Like
Yeah.
clarifying, still for 2 more weeks we're in distance learning, and January 4th we're in seats, or whatever we want to
Please
say.
log
Good
in.
point.
Please
That's
attend your
Good
meetings.
point.
That's what I meant.
Parents, encourage
So-
your
So
students.
to wrap this up, where are we going right now?
Do we have any other issues to discuss in the returning to learning draft as we see it right here, right now?
No.
Does it matter that we have not had any input in this plan from specific, so I'm going to bring up athletics again because I'm still getting it. Travis represented the AD from the high school yesterday and the middle school coaches. Every high school coach has asked to be allowed to have their athletics. Do we have a reason for that not to happen?
Now I'm confused. That's not what I read.
Okay, so they're asking to have athletics while we are still at distant learning, and because right now, one of the
So I can't
reasons
get this
that we're
to
not going back to school is we have no food, because we did not have our decision made
What?
by the deadline in order to order the food. Let me make that
Yeah,
clear so
and-
it's
and
not on the food
I want to
service.
make it clear that that has nothing to do on our food service people.
Yeah, that's what I just
No.
said.
That's
You
all right.
just copied.
That
Yep.
is
Yeah, we know
all
that.
on
We're
us.
well
No, that's
aware
what
of
I
it.
just said, so.
Yep.
Our
And she
food
seconded
service
it.
people are
It's
great.
second. Food service has nothing to do with it.
No.
It's the fact that the decision wasn't made in
We didn't
time
make the
for
decision.
them to be able to order their
That's
truck.
that's
Okay,
right.
And so,
just want to make sure everything's on the table. So, but we are currently in phase 4. And phase 4 states that no sports, as long as we're at distant learning. So, sports are now asking if they can have practice for the next 2 weeks coming before or 3 weeks, however many it is, prior to January 4th.
Is it just practice they want?
No.
I'm sure it's full.
No, they want to
So,
play. Everybody else
So
is.
while we had some discussion earlier, after someone asked me, what does Misha say? Misha has 8 pages of guidance that I read through while we're on here. Misha pretty much,
Says it's your choice.
yes.
I know,
The
I read it.
document says it's up to your discretion, it's up to your discretion. They tell you that
Hey, Matt.
to operate in Tier 1, you
understand
should
that.
have the essential personnel there, which are
Let's
the
not talk.
athletes, the coaches, the umpires, refs, no media. Tier 2
Do we
brings in
have
media
a,
coverage.
do we have,
Tier
I don't
3
know
brings
if I
in
want to even bring,
spectators.
yeah, I do want to bring it up. We're going to talk everything. Are we having then a difference of opinion between coaches and administrators when it comes to sports right now?
I don't know that we can say that.
I don't know if that's fair to say.
That- I don't
but
think that's
We don't have
fair.
anybody to represent each
Yes.
side.
Well, but the administrators seem to be saying, or haven't said,
That's right. Dr. Ian made it very clear. If we're not in class.
well, if you're not in
If it's
class,
not
sports.
safe,
we're not,
those
no,
are the
that's not where
words.
I'm
If it's
going.
not
I want to
safe
know,
to
maybe we
class.
can clarify.
So
it.
currently, we do not know if it's safe. We do not have numbers, period.
We do have numbers. We have district numbers.
Do we have district numbers?
Yeah.
I haven't heard them tonight.
Yeah, I'll tell them to you for right now today.
We have district numbers that have been reported to us because we actually don't have kids that are coming to the building, so we don't know what we caught or not caught, because these are only numbers that are people that are coming into our buildings or that things are reported, or quarantines that we know about.
Well, the health department's still contacting our nurses per Rosie.
Right, I understand that, but they're only getting
So
contacted
at the
by
high
the
school
people who
level.
are testing and that they actually know some positive things.
The high
on.
school, we have one 11th grader and one 12th grader that are positive. We have 3 total, this says, as of today, we had 3 total positives in the high school.
Only 3?
We have,
Is that including adults or
I'm
students?
looking, we have, how many positive staff by building? It
No,
says
it's
1
57.
that will be off quarantine on 12/14. And we have one that will be off quarantine, one teacher that'll be off on 12/4. So today. The total numbers are 10 positive across the district, 10 positive and 30 quarantined.
That's pretty good.
Should be in school.
As of December, and this document says December 4th. Let's not forget that these are worse this week than they were last week, but not by many.
And we're gonna get, when do we get the Thanksgiving?
They're here.
The numbers are starting now
Yeah,
for
10 and 30.
Thanksgiving.
10 positives, 30 quarantine, that's good.
And then you'll have Christmas.
And that went down, as of yesterday, I think we had, maybe there were, I better not say, I don't know for sure. I don't know for sure. Those numbers have gone down today from what they were yesterday, a smidge.
Here's some guidance that I need to give to our high school and middle school. The high school has been on an A-B block schedule. Half the kids in the building Monday, half them on Tuesday, and vice versa. We had suggested, because the middle school had been hit so hard with quarantines, we suggested that they also go on a block schedule because the high school had done well. Now, when we go back on January the 4th, and I'll make it clear, we are in distance learning up until Christmas break.
Yeah, the 18th.
When we come back on January 4th, do the high school administrators have that option to institute a block scheduling? Or, and I don't remember, Brian, if the committee said, if all 800 students are coming back to the high school.
Well, they said that there was no way to social distance them, but
It's-
true.
I thought that I had been hearing from the medical,
I thought I asked at one point if Beaker could do like an AB day, if that
You
would help.
did, Matt.
And we were told no.
Right, we were, and then, so we told, the central office told the Beaker administration, you need to do this.
I mean, it kind of makes sense, but I'm not in the building, so.
No, yeah, you're right. And was it more difficult than the high school? Absolutely.
okay, so
But if it keeps them in their building.
Yeah.
does Acellus, or whatever that thing's called, does that aid our teachers? I mean, does that truly make their life easier with distance learning?
That will be easier for our teachers with distance learning, yes.
Harry, why are you telling me no?
Depends on how they're doing it, if they're splitting them. Because I did that with a class of 39, and I split them and met face-to-face, and then the other ones were online, and then face-to-face and online. It was tough to do.
These are just totally different.
These are all distance
So when you
learners.
go on A block, I've never understood how we're doing it. So when you go A block and you go B block, so then those other kids are off 3 days a week?
Well, the Acellus
Or are they
is for-
meeting online?
Acellus is just for, my
for
understanding
all
is just
distance.
for the people that are 100% distance learning.
That's
Okay.
correct.
So it really doesn't help our teachers. It doesn't help our teachers if we're A-B day and they've got those half of their class at home.
Yeah,
This does not help. Acellus doesn't help them.
yeah. It's
So
hard to
if we're
keep them.
if we were gonna spend money, why didn't we look at sending those distance kids to Launch or MoCap and
Because that is really expensive.
well, but I mean, my child's education is really expensive.
Well, okay.
I mean, fair enough. I don't know. I'm not a fan of going back to an AB schedule second semester at the high school. Our kids have missed out at the high school, and I would hate for that to happen at middle school.
I thought that we had heard from the medical professionals that what the high school had been doing was working.
Yeah.
And that
Medically,
was-
but maybe not educationally.
And that actually was something that I've been thinking about with all of this discussion, that we've got two different issues
Right.
going on.
Right.
We've got how are we dealing with coronavirus?
And how we gonna
That's
do
over here.
education.
And how are we dealing with curriculum? Now, here's the thing. How are we dealing with curriculum? This is about to turn into Saturday, right? Like, we could be here through Sunday.
Yep.
Figuring that out. We need to dedicate a meeting probably to that. That's not the apple that we're biting tonight.
Yeah, because I've seen 2 or 3, well, no.
This is about the
Diane needs to be
plan.
involved in that meeting.
Yeah, and that's part of why I was like, is she gonna stay? But this is about the plan. This is
Right.
about, okay, we've got these revisions.
Yep.
Let's talk
We have till
about,
11 a.m. to get them done.
That's right. So,
Do you need a motion for
No,
us, or just our
we don't
support
vote
to
on
tell
it.
you that we will?
we don't vote on it. She just needs feedback from us, and it can be individually. This gives us a forum to talk about it.
All right.
It allowed even
So no-
for some public
no
comments.
sports.
and so
We
that's
can
worth
still go to
voting.
SEC, but we can't do sports.
Can we do,
So, no, oh, okay, back to athletics, that's right. We lost
I
the
just,
thread
I
on
mean,
that. No,
Well,
that's
it-
fine. We lost the thread.
there's, go ahead. Go.
well, I'm getting asked by
Yeah.
coaches is if they come up with a plan to break their teams up into small groups, can they practice?
Can we run that through the working group and make sure everybody, all of our stakeholders are okay with it? Well, then ask another doctor to attend. You know, if you don't like the medical feedback that you're getting from the
They're-
one,
they're
then
not-
try to pick
they don't
another.
have- The problem is it's not about them weighing in, it's about their time. And they're exhausting their time trying to find us a vaccine. And the governor came out with all of these new things for all of our local health officials, and they're trying to implement those. They're overwhelmed, and
I'm not
that's
a
the
medical,
issue.
I can't weigh in on whether it's okay.
One of the things that's very important to look at that Misha said was that sports are voluntary. Parents have the choice to send their kids to practice no matter what we say over here or not. Students have a choice to participate how they feel on a safety level.
Perfect.
So if we say that we're going to allow practices to go that way with it, Ellen, if we say we're going to allow that, then people still have the choice to participate or not within those practices on how they feel.
Sure.
If you want to go to that point.
I mean,
That is
kids
what
would be able
Mish's
to opt
guidance
in.
was that basically you
That
had a
makes
choice
sense.
to go because there's nothing that says you have to.
Devil's
That came-
devil's advocate, what about the, and just to make sure, actually, I'm following Kirsty's example here, just to make sure we're talking about all the details. The students do, the parents do. What about so I guess our coaches could just resign their coachship if they felt kind of like this is not safe? Or what about the bus drivers who have to drive the kids there? And I've seen video of kids not wearing masks on the bus.
Yeah,
And we
ridiculous.
have elderly, we have people who, I don't care if they're elderly and frail or not, we got human beings driving the buses. So if coaches are willing to be responsible, if the buck's gonna stop with them to make sure that everybody is safe and responsible.
Okay, so let me go here.
Yeah, I was gonna say,
We-
keep going.
We are not going to be able to make that decision today.
Yeah.
So we need each department to have that collaboration with their team and I'm not necessarily talking sports, but like school bus, your employees who, if we have comfortable people or not, and maybe we just dedicate a meeting just to talk about early next week about sports and if we're comfortable and everybody that is going to play a part in that. So we can actually weigh out all the odds and ends of, safety and proceeding to do it.
And oversight, because there
Right.
are a couple of things in it that talk about disinfectant and cleaning schedules, that there should be a point person that's looking over that.
Sorry, I
There
don't
has
know
to
why
be
you're
someone
talking
who's
about.
looking over your positive COVID numbers, making sure that your quarantine timelines are followed, and those types of things. So all that has to be charged by somebody, of which we would need to also appoint someone within the district, whether it's the AD or whatever, a nurse, whatever it is, to help with parts of that, as well as somebody who has to oversee the competition aspects, as well as the cleaning and the safety of the practices as they would be going at that time.
And I think you also need to look at, there are a few days before the actual Christmas in that week, and then the week following Christmas, we always have practices
Yeah.
during that time. So we need to keep that in mind and give guidance based on that week also.
Are teams practicing and participating now? I don't
No,
remember.
no, sir.
No.
Not ours.
Not ours.
I come from a very big sports family, and it's very important for my students to be involved in their athletics, to do their schoolwork. So there are pros and cons to this on both sides, and there's also safety. So I say that let's just invite everybody in the room and let's hash it out and find out what's best and go off of that information.
Let them be at their choice. They don't feel safe, don't go to practice.
Yeah, I can't believe that came from Michigan.
Yeah,
That
but
was
that's
pretty
still,
good.
we still gotta talk about the coaches and the other folks who support that too, because,
I think as far as the coaches, I think they're all ready. Well, most of them. There might be, you might
At
find
the
that there's
high-
another
I
coach
can't speak
that's
for
not.
anything but the high school. The high school, I have personally spoken with every varsity coach in a winter sport, and they are ready.
And
They're ready.
there's a difference.
Been ready.
Oh my God, I hate to.
Okay.
I think that we need to make
There's one,
sure
maybe
that we
not?
have them there. Yeah.
Okay, perfect.
I think that you just have to talk with them and find out what their practice schedules are gonna look like. What is gonna be outlined if you need to look at it for feeling safety about it as a district allowed.
Okay, so if we're going to have a meeting about this, then what I would like is to have all of those ducks in a row.
Yep.
And then we'll set the meeting. Show me that everybody's got a plan and they're ready to come here and talk about it. Tell me who's
They
going to
have-
come here and talk
They
about
have
it.
it.
Give me names.
You're gonna want Ian off of quarantine too.
And that's going to be an
Absolutely.
issue.
It would make sense.
Or can he can zoom in, can't, well, it depends on how he's feeling.
I think she'd have,
We can touch base with him to find out if he can zoom in or if he's not able to. And then that's when we can reschedule.
Yeah.
Based on.
Yeah, he could,
all right.
But I do think you need to have transportation if we're gonna compete.
okay.
So, yeah.
Yeah.
Any other questions about the returning to learning plan as it is here? Matt, did you have something else that we didn't get to?
Well, I do want to mention something before I'm finished.
Okay.
Yeah, I did.
So,
Oh, you did?
on here, it also says no public events, and we're talking about sports. We also have the youth sports, and they are our school kids. So if we're going to consider those things, they are in small groups. I can speak for basketball, can't speak for wrestling, but if they did the same thing, then I would like us to take that into consideration.
So you mean non-school?
It says non-public events public events is not allowed in our schools. And so that'd be considered an outside because they're not an affiliate with the school, but they are our school kids and they are in small groups of 10 and less.
Where they
Doesn't matter if
practice.
they are school kids
And they
or
are not
It's just
practicing
that
right now.
We'd be allowing people from the community
there
to
you go.
use
Okay,
the
see.
gyms, period.
Yes.
Or to use facilities in small groups for specific purposes.
And they have submitted COVID information to Dr. Mayer to be approved to make sure they had procedures that they were following.
The Knights basketball, I haven't got it from anybody else.
Okay,
Yeah,
so if they
that's
have,
what
if
she's
the other
referring to.
people have not, then I cannot speak on their behalf.
so what's your question, Mr. Matt? Too long.
So,
You got till 11 a.m. tomorrow to.
Well, I think I kind of wanted to discuss, or maybe I can email Brian and ask him more, because
I guess so,
the change, just about the daycare,
next week.
for the employee, like, where someone had in mind, like, what part of the building is that going to take place?
What I said when I talked about
Pull your
that
mic
we
down
would
so
have to
people can hear
do.
you.
So what Matt said, in case you all didn't hear.
There
me,
you go.
since that information is that Matt wanted to know if we looked at doing some kind of option for our employees of helping with the childcare issues, because they're going to have to be in school next week, and they're going to remain, our staff, working in buildings starting next week. Where would we look at doing something like that? What I suggested is that we would use a certain set of cafeterias of some sort. We would use something like this area, maybe where we could house 15 kids, and we might have one person here. We might use another hub like Beaker. We might use another hub like Benton. Doesn't matter where we do it. I said we should use gyms or cafeterias because they're the largest open air spaces that we've got around here. And so those would be the places, and we would sign pairs to those places. On the call, there were pairs who said that they would be more than ready to start doing that next week, because we did have pairs on the phone yesterday.
I did say that. Cool. I just got a message from Diane, who's the athletic trainer for all of our high school athletics. And she said, just to let you and the board know, I take the kids' temps and screen them every single day before practice.
Cool. Write it up, bring it up to
So-
plan, let's all make sure.
There you go.
everybody's
So we'll need to
ducks
include her in that. So, Dr. Mayer, is that something that you'll have Kristen arrange, or?
Basketball practice?
No, like,
No,
we're not,
no.
are making sure that everybody's got all the coaches who say they've got their.
Dr. T, don't give me that.
I don't have it.
That's Kristen's job, I think, isn't
Okay.
it?
Yeah, that's why I just was
Kristen-
saying,
If Kristen could kindly wrangle all of those plans, make sure she touches base with Ian about this and finds out who wants to come here to talk to us about their plan or just send in some sort of written plan so that we know.
Do we have a date for that meeting yet?
No.
Next Wednesday.
What I'm saying, no, I can't do it
I'm
then. I'm actually, that's like the
Well,
day
nobody
I
asked me
know
about
I'm
tonight.
busy. No, what I'm saying is,
Glad I'm on vacation.
what I'm saying is, when we get all those ducks lined up, when we know, okay, here's everybody's plans, then I'll call the meeting.
Okay.
But I don't want us to come in here and not have things to look at and things to talk about, and for us to just be, whistling Dixie.
Dr. Mayor, and you might know, professional development on the 4th of January is, so I'm trying to get to your calendar right now.
The 4th of January should be the first day in school.
But
Right.
so I'm asking because I just got a message that there's
So 4th is
professional
PD day?
development for the teachers on the 4th.
That ain't gonna
So is that something that takes all, is meetings where they can't?
Don't they usually get one day when they come back to open?
Yeah, that needs to, I need to talk to the curriculum director and the rest of the administrators on that.
Okay, so we really don't have the 4th as a start date for the kids then, if you've got something scheduled for the teachers?
Hence the tentative.
So that would be that tentative based on the teachers having.
Well, I think it's fair.
Because I found a meeting.
I'll be able to tell them tomorrow.
Oh, yes, no, I was just being sarcastic to Matt.
What would be appropriate is,
Mayor, you could schedule that between now and Christmas break.
no, they need to be in
We don't
school.
interfere with January 4th date for our kids.
Well, they need to be in school between now and the 18th.
And she said she would work that out,
But
so.
what we could do is just say, the board has requested that we follow the calendar that we've already approved for second semester, and come back appropriate, which, if that's the 4th and the 5th, we come back, whatever we already approved for second semester, why does it
I don't know what
need
it
to
is. I
change?
was trying to pull it up, but I didn't get there.
We've already voted on that. We voted the calendar back in whatever month. So why does that need to, I'm asking why that needs to change.
I
I
don't
mean,
Nobody was saying
then the
it
teachers
does.
would get the appropriate PD.
Nobody said it did.
Right, no,
I'm
I
saying
know
that
that.
we didn't look at a calendar tonight to know
We
these.
didn't look at a calendar yesterday either.
So that's all I'm
That-
saying.
And so that's my question also, like, maybe we don't,
So we
maybe.
need to look at a calendar is all I'm
The
saying.
calendar doesn't, maybe it's set already.
Right, so we need to look at a calendar.
Mine doesn't say.
I'm just looking and looking and looking.
It's on our website.
Oh,
Well,
my
yesterday, that was
emails.
never brought up that we had something on the 4th, that the 4th would be a,
I don't know. I'm gonna go, I'm gonna like calendar.
okay.
Maybe it'll pop up.
We were making progress.
I was gonna say,
I feel like we're in the committee meeting.
are we looking for?
Yeah, we really are. Yeah, we really are.
We revised the plan yesterday, and 20 pages of the plan in 3.5 hours. We talked about the plan for 2 hours tonight.
We talked about a lot.
And made no revisions, pretty much.
Yeah, we've talked
So
about
when
a
you want
lot.
to talk about effectiveness,
There you go. You know what? I want to commend you, Brian, on seeing some of the stuff you've been able to pull
it's
together.
not just me. Dr. Mayor's got a lot of time in there,
No,
but
I
yes,
know
we've worked on
too.
it together. Thank you.
I know, but I'm just saying, for me, as a board member, I don't know that I could have stepped in and done what you have done. So, brought a lot of different people.
I can tell you,
together.
Dr. Mayor and I have spent at least 10 hours this week, probably, between phone conversations and revisions,
Yep.
as
January
well
4th is the
as
first day
things
back of
with
the second
the
semester.
committee as well.
Calendar. for
I mean,
everybody.
it takes a lot of work to change a plan.
Okay.
And she will tell you it takes a lot more work to run the district, I'm sure, because I am more than happy not to have to enact any of these changes.
So Christy seems to have a date.
Got a date.
January 4th on the calendar, it is the first day back on second semester. I just verified it on our website.
There you
Okay,
go.
but was there something about a PD day used in August for that January 4th day? Remember, because we changed and added a PD day or something?
Well, if it says the kids are coming back on the 4th, let's just bring them back on the 4th.
I was gonna say, we may have made
And
some
Dr. Mayer
adjustments
said she
because
had
we
handled
did
the
add
rest.
a couple PD days in the
I
beginning
remember
of the
that.
school year to get ready for the situation
But
that we were dealing with.
but
But if the
everything
calendar's
is-
setting, the
It
calendar's
re- Yeah,
setting.
it replaced that day.
Yes.
So
Yes.
January 4th, we're in seat.
Well, that
Or whatever.
may be the only time we ever start school on a Monday.
Right.
After a
Yeah,
holiday.
you're right.
Makes perfect
Okay.
sense to me. That never happened.
Thank you, Dr. Mayer, for your hard work in getting that to us. I do like
You're
a
welcome.
lot of those changes.
Yeah. Kudos to the working
I'll
group.
look it over.
Good job, group.
I haven't had a chance to read
I
it
make a motion
thoroughly.
that we adjourn from open session.
Second.
Oh, I heard Ellen
closed
first.
session.
Roll call. Let's start with Ellen.
Aye.
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 I would have never thought you would have got a second from Ellen. on that.
7:58.
came off.
Okay, we're gonna turn those on.
Yeah, I said it. I said I never would have thought you would have got a second from Ellen on that
Y'all see
one.
me, I'm asking Kristen
I
to send
mean,
out a text.
no
for her.
sense in spinning the wheels.
And, okay.
I mean, I've already been told.